Australia's chief medical officer defends securing 53 million doses of the AstraZeneca vaccine amid concerns it does not have enough efficacy to achieve herd immunity compared with the Pfizer and Moderna vaccines. Marvy Delfin will give us the details live. Yes, Marvy.
Harleen, on Tuesday, leading scientists from the Australian and New Zealand Society for Immunology called on the federal government to immediately pause the planned rollout of the Oxford AstraZeneca vaccine after the interim results of the Stage 3 trials found that the vaccine efficacy is at 62% for those given the recommended 2 full doses and 90% in those given a half, then a full dose. There was also indications that the AstraZeneca vaccine protects against symptomatic disease in 70% of cases. The varying rates of AstraZeneca's efficacy has created significant uncertainty over the vaccine's true effectiveness, though not a single person given the proper dosage developed severe COVID-19. With some health experts and the opposition party advocating for a review of the government's immunization plan, Australia's Chief Medical Officer Paul Kelly is concerned that the debate over the efficacy of the AstraZeneca vaccine could undermine public trust, which is key to the country's vaccination strategy.
I just want to be very clear, the AstraZeneca vaccine has several reasons why it's very important for our vaccine strategy. Firstly, it's being made here in Australia. There will be enough vaccine very soon in Australia for Australians to be able to vaccinate any Australian who wants to be vaccinated against COVID-19 this year. Second of all, it is very effective against severe illness. It will save lives. By using this vaccine, we'll be able to protect a large proportion of the population in Australia.
Australia has secured 53.8 million doses of the AstraZeneca vaccine, which is to be delivered at roughly 1 million doses a week, while only 10 million doses of the Pfizer-BioNTech, which is 95% effective, will only be given to those most at risk starting in February. Dr. Andrew Miller, president of the Australian Medical Association's Western Australia branch, said that a vaccine that did not provide herd immunity would not meet the public's expectations about returning to pre-COVID normal, especially when Australia has the resources to seek additional supplies of the best vaccines available. But the Australian government remains firm that there will be no plans for a policy U-turn. However, the co-chair of the Australian Technical Advisory Group on Immunization, Professor Alan Chang, said that it was important to remember that the AstraZeneca vaccine has not yet been registered by Australia's drugs regulator, the Therapeutic Goods Administration, and neither has the Pfizer vaccine. It is also feared that the emergence of 2 more transmissible variants of COVID-19 in Britain and South Africa could raise the critical vaccination level beyond what the AstraZeneca vaccine could achieve. Harleen?
All right, thank you, Marvy, for that report live from Australia.